Hi, my name is Dr. J.L. Khatib. I am the lab director of your diagnostic laboratories in JLT. Today, we will talk about sexual transmitted disease. The question is why they happen, how do we look for them, and why we test for them. Now, sexual transmitted disease is usually caused by bacteria or virus. The reason we are checking for them is because, of course, they will cause discomfort, symptoms, and somehow they are related to infertility, because sometimes they are also can be silent and not looked for. It's very simple to detect such a disease because we use advanced molecular techniques. This is usually required a visit to a professional. The professional doctor will collect a sample from the patient using a special swab. The swab will be taken directly from the genital area. This swab usually is treated in the laboratory by a trained medical technologist who will identify the sample and confirm the ID of the sample, and then it will be used to detect the disease. The question is, how accurate is the detection technique? Since we are using molecular methodology, or the way we test the disease is using molecular technique, we will handle the sample into an automated DNA extractor. Basically, molecular technique means that we will look for the DNA of the bacteria or the virus. So the device we use is fully automated, so there is no contamination or any carryover from any other source. Once the DNA of the bacteria or the virus is extracted, we will make sure that we have enough concentration of this to proceed to the next step. The next step is called amplification, where we will try to propagate or increase the copy number of the DNA that we have taken from the sample, so we will not miss any type of DNA from the virus or the bacteria. This is usually done by a device used for amplification, specifically designed to target specific codes or sequences in the sample. Once the sample containing specific code for a bacteria or a disease caused by a virus, then the amplification will take place, and the signal of an amplification will be very visible. This is also followed by a visual confirmation using microarrays. It's a full array containing about 20 different bacteria and viruses. So we will not miss any of them. If it is there in the amplification step, we will find it in the array study. You will ask what type of diseases or bacteria or virus we can look for in our sample. There could be many, such as Candida, Chlamydia, Neisseria gonorrhea, Mycoplasma, Ureaplasma, Trichomonas, herpes 1 or herpes type 2, or treponema, which is causing the syphilis. Now, it is very important to indicate that such tests can see a certain group of bacteria and viruses. However, there are different things as well that can be looked for through blood testing. You can do a blood testing for checking other things as well, like HIV, hepatitis B, hepatitis C. It's very important to consult your doctor when you have an issue with infertility and recurrent miscarriages to investigate such case like sexual transmitted disease. And also important to focus on the idea that it is really important to work on a molecular base, which is looking for the actual nucleic acid or DNA of the bacteria or the virus. For any more information, you can find us on the web, www.ydl-me.com, or you can call us toll free at 800 YDL, that's 800-935. Thank you.